I'm going to show you a video now of someone suffering from snoring and sleep apnea. And you'll see how it interferes with normal sleep and why that person is exhausted in the morning. Okay, here is Nick. Nick is asleep. He's trying to breathe right now, even though his mouth is opening and closing, and you see his shoulders going up and down. He's not breathing. He's in sleep apnea. He's occluded. Now he snorts, he gasps, he tries to breathe. You hear him snoring. He's awake again. He's breathing, he's snoring, and here he is. He's occluded again. So now he's obstructed. He's not breathing. He's still not breathing. You can see his mouth opening. He's attempting to breathe. His shoulders are raising. His chest is expanded, but he can't breathe because he's completely occluded. He's still not breathing. Oh my goodness. All right, and here he starts to breathe again. He wakes up, he arouses from sleep. He's breathing, gasping, trying to get some oxygen in his lungs. He's breathing, getting oxygenated. And now he falls back asleep and he's occluded. Look at him trying to breathe. Look at him trying to breathe. Imagine what his blood oxygen is doing. It's going down to almost nothing. You and I, when we're awake, our blood oxygen level is in the 90%. His is down in the 60% range. Look at him. He's still not breathing. Still not breathing. And his mind says, okay, wake up, you gotta breathe. And he wakes up and he breathes again. He's breathing, getting oxygenated, getting oxygenated. All right, so after watching that video, is it any wonder that Nick suffers from hypertension, low blood oxygen, enlarged heart because his heart is desperately trying to circulate unoxygenated blood, cor pulmonale, which is enlargement of the heart, pulmonary hypertension, excessive daytime sleepiness? He wakes exhausted. It makes me exhausted just watching that video. And you know what I mean just by watching it. He also suffers from mental confusion, anxiety, depression, increased chance of motor vehicle accidents, accidents at work, heart attack, stroke, all of that just from getting a poor night's sleep. Of course, socially he suffers too. He's not very happy in his marriage. His wife hasn't slept in the same bed as him in 10 years. He can't go to parties. He falls asleep immediately. He gets to the party, says hi to everybody, sits down on the couch, and immediately falls to sleep. So how is snoring and sleep apnea treated? The gold standard for treatment is the CPAP, the Continuous Positive Airway Pressure Mask. The CPAP is almost 100% effective. How does it work? Let's go back to our root beer float. Remember, the straw is stuck in the ice cream, and we can't breathe in. We can't suck any root beer through it. But if we blew through it, it would inflate the straw, and we'd be able to get air through the straw. That's exactly how a CPAP works. It's either a nasal mask or a nose and face mask that blows air down the airway. It acts as a pneumatic splint. It blows the airway open. The only problem with the CPAP is, although it's 100% effective, it's only 20 to 25% compliant. That is, 75 to 80% of people who are given the CPAP can't wear it or don't wear it. I have patients come in and I say, oh, you have obstructive sleep apnea? Yes. I said, do you have a CPAP? Yes, I do. Do you wear it? No, I don't. Maybe once a week, maybe twice a week when I'm really exhausted. So that person, 5 or 6 nights a week, is like Nick. One night a week, they're getting a good night's sleep. So you see they're getting sicker and sicker and sicker, even though they have a CPAP. When a patient comes in and tells me I have obstructive sleep apnea, and I have a CPAP machine, and I wear it every night, I'm done. I don't argue with them. I tell them, wonderful. I'm so glad that it's working for you. You are 100% treated, and you're not suffering any of the ill effects of snoring and sleep apnea. But for those patients who try a CPAP and can't wear it, or won't wear it, or travel a lot, the CPAP is also very difficult to travel with. There's even signs at the airport now that say, please take your laptop out and any video cameras and your CPAP machine. So these people have to go through security, open their CPAP machine. So I know a lot of my patients come in and say, I have a CPAP, I wear it when I'm home, but I travel like 20 weeks out of the year and I don't bring my CPAP because it's too hard to travel with. For them, the oral appliance is wonderful. Okay, so that's the CPAP machine. The oral appliance, how does that work? The oral appliance, what's the first thing we do in CPR? Someone's not breathing. First thing we do, we grab onto the lower jaw and bring it forward. We protrude the lower jaw. Well, how does that open the airway? Remember, that tongue muscle is attached to the inside of the jaw right here. So when we bring the lower jaw forward, we're pulling that muscle forward and opening the airway. We only need a couple of millimeters. So that's what the oral appliance does. The oral appliance brings the lower jaw forward a certain amount, usually about 70% of maximum, and it holds the airway open that way.